My name is Nima Abdi Hassan. I'm 28 years old. I was born in Mogadishu, but my parents left Somalia before the war got so bad, so I grew up in Kenya. We came back to Somalia in 2002 because my father and mother thought that it was our duty to come back to get to know our fellow people and help them. I studied medicine at Benadi University in Mogadishu because I always felt it was my path to become a doctor. When I started working, the war became very bad again. So I started to treat civilians who were war wounded. This gave me a lot of experience with surgery and trauma. But in 2010, when the fighting subsided, I was able to focus on obstetrics and gynecology. Women will sometimes travel up to 300 kilometers from rural areas to reach Mogadishu to see a doctor like me when they have complicated births. It will often take them 3 days along bad and dangerous roads. They arrive in severe shock and have lost a lot of blood. Some cases died. We must build more healthcare centers across Somalia in rural areas and also train birth attendants to stop this happening. Many doctors fled the country because of the war. Some came back to be lecturers at Mogadishu universities, but in 2009, there was a terrible attack at the graduation ceremony of Benadi University. A bomb went off and many students were killed. I know many people who died, and we lost some of our best teachers. They were the people who helped bring the teaching of medicine back to Mogadishu. Now I am employed by the World Health Organization. When I first started to work, men were prejudiced towards me, but now they are more cooperative because they feel I am capable. A lot of the cases I see are related to childbirth complications, often caused by women who have been subjected to FGM. Recently, a 6-year-old girl was brought in with severe bleeding because when her family performed FGM, they cut a vein. I had to stop the bleeding or she would have died. One patient died last year when she was in labor with her 12th child. I warned her that she had had problems and she shouldn't get pregnant again. But her husband put pressure on her to get pregnant and her body couldn't cope. Domestic and sexual violence is a big problem. Sometimes women are injured and I will treat them. The most satisfying part of my job is being able to help people. Through saving lives, I feel I'm serving God. I like seeing people's happy faces when their relatives get better or when a woman gives birth successfully. Just as you finish one difficult operation, there's always another that's normally more difficult. There's a huge role to play for women in rebuilding of Somalia. Now we have women heading government departments, and this gives hope to Somali women.